Let's see how Hawthorne Thornley Medical Centres supports patients who can access their medical records, and also what information it provides for them to help them understand their health better. So this is the home page of the practice website, www.htmc.co.uk, and here on the left you can see that the patient can access their medical records from here. So let's click on Access Your Medical Records, and let's put in the passwords for the test patient. Sign in, and let's then view the medical record with the second password and confirm. And this is the summary page, and in order to find out what the results of the smear or last smear is, click on Record by System and then click on Laboratory Tests. This is where you can find out where your smear results are. And as it comes through, we'll see the date of the last smear done. And you can see here it's the 3rd of January 2009, cervical smear, severe dyskaryosis and refer colposcopy. You can also see consultations on the system, so if we go to consultations, then that will pull up consultations that the patient has had with the doctor or nurse, and we'll see that a consultation took place in August with myself, and it shows that this patient was diagnosed with cancer of the cervix. They've been diagnosed with cervical cancer and referred to Christie Hospital for further management. Has supportive family, says the hospital have been excellent at keeping her informed about what is happening and offering choices. Has had contact with one of the doctors in the practice and thinks we're wonderful too, wondering what else she can do. And in the comment section, advised to get access to her GP electronic health records, looks at the self-care section including advice from NHS Choices, and to monitor her health including her weight, blood pressure and future appointments on HealthSpace. And that's the information that I would record in the patient record, which the patient can now see. You'll also notice that next to the term cancer of the cervix there's a little blue I button, which is the information button, and this takes us to a whole list of websites that are linked to cancer of the cervix. And if we take the first one for instance, then you'll see this is a leaflet by patient.co.uk, and it talks about cervical cancer and what it is, what is cancer, what's cervical cancer, what is the cervical screening test, what causes cervical cancer, what are the symptoms, how is it diagnosed and assessed, what are the treatment options for cervical cancer, and then finally what's the prognosis or outlook. And there's further help and where they can get further help from, and references, and then further support articles, videos, links to other websites, and recent related news items on cervical cancer itself. If we now also go into summary record, then we can see summary information that the patient has, and that includes significant active problems, and again you can see there on the 3rd of August this patient has been diagnosed with cervical cancer. Okay, let's log out of the system. And close that down. And if we come back to the home page, then we can see NHS Choices, where you can find out what choices there are about cervical cancer. And if we search that and have a look at the introduction, then you can see here an introduction on cervical cancer, giving you brief information about it and the fact that approximately 3,000 women are diagnosed with cervical cancer each year. You can see a video from a gynecological oncologist explaining the symptoms of cervical cancer, who's most at risk and the treatment options, and then symptoms, causes, diagnoses, treatment, prevention, expert view, lifestyle, real stories, map of medicine, and Reuters News. If we come back to the home page, Then you saw Map of Medicine before. Let's just click on Map of Medicine. Map of Medicine is an evidence-based pathway produced primarily for doctors and nurses, but is also available for patients to see. And I've typed in cervical cancer there, and if we click on that, then you can see the pathway. So here's cervical cancer presentations and the clinical presentation, and these are some of the symptoms that people can present with who might have cervical cancer. I should add that these symptoms don't necessarily mean cervical cancer, and there are other causes besides cervical cancer for such symptoms. You can also see here abnormal cytology following a smear, and if you follow the pathway, go to abnormal cytology, and you can see here all the different types of abnormal cytology there might be. And in the example of the patient that we've just seen, this patient had severe dyskaryosis, and you can see a little I button. If we click on that, it tells us more about what severe dyskaryosis means. Provide patient information, refer for colposcopy. You'll notice this is all green, which is explaining what happens in general practice or in primary care, but at this point it changes to blue, which means what happens when you get referred to the hospital. And this is what happens when you get referred for colposcopy. And then if you have a biopsy done, then these are the different types of results. And if it suggests cancer, click on management, and then you can start to see how we would manage someone in the hospital who's been diagnosed with cervical cancer, and the different types of treatment that might be available, including radiotherapy, chemotherapy, and perhaps surgery too. So that's the Map of Medicine. If we now go to HealthSpace, HealthSpace allows you to record your own information about things. Now I'm going to log in with my own details. And once we've logged in, then we'll be able to go into the health and lifestyle section. That's it, we're in. And if we go into health details, then you can put in things like height, weight, health notes, and so on. So if we've been measuring our weight, we could put our weight in there, the date, and then you can see what weights you've recorded in the past. You can also have it in a graph format, so you can see over a period of time what's been happening with your weight. In health notes section, you can put in reminders in here for yourself for next time you go and see the doctor or nurse, and questions that you might have, so you can view them later. So for instance, I've made a note here about need to find out whether I will lose my hair if I choose to go on chemotherapy, and once you finish with it you can delete it there as well. The other useful thing is calendar and address book, and if we go into calendar, then you can put in reminders for appointments that you might have. So for instance, if I put in here as a title, cancer appointment, and that's at Christie Hospital, and it's on the 19th of September 2009, and it's at 2 o'clock. It's a half-an-hour appointment. I would like to be reminded of that appointment one day beforehand, and here I can choose to either have a reminder saying check in HealthSpace what the appointment is, or if I don't want people to know or be able to see the email and see what the appointment's about, then I can choose to leave it like that. If I tick the box, then it will remind me what the appointment actually is. I can add in any notes. Remember to arrange a taxi to take me there, and that's details of the actual appointment, and we can save that. And if I then go back into calendar, then I can see what appointments I've got, and you can see there 19th of September, there's a cancer appointment, and I can view it, and that's the view again. Okay, so that's HealthSpace. You'll also see pre-consultation care, where you can download a questionnaire that helps you to think about the appointment that you'll be having, whether it's at the hospital or at the GP surgery. Information about record access and how you can get it, and then any talks that we've got will be in this section here. And that's the end of this.